All right, well, let's just go ahead and get started. Welcome, everyone, to our November Community of Practice. We have greatly missed you all. We have a wonderful presenter today that I'm going to introduce, and I'll hand it right over to her. And so this is Adrienne Nash Melendez. Adrienne Nash Melendez currently serves as the National Director for Supportive Services for Veteran Families, or as we all know so well, SSVF, at the United States Department of Veteran Affairs. Adrienne has over 20 years leading local, state, and national initiatives and programs with a focus on housing, homelessness, community development, and supportive services. Adrienne holds a master's in leadership development from Penn State University and a bachelor's in sociology from Washington College and certificates in project management and human resources. In her free time, she enjoys playing the harp, spending time with her family, and volunteering with her community of faith. Thank you so much for being with us today, Adrienne. And with that amazing bio, I will hand it over to you. Thank you.
Awesome. Thank you so much, Sarah. And I am so very excited to be with you all today. Next slide, please. Awesome. So we are just really grateful for you all. I think HVRP has been such a phenomenal partner in the work that we've done together in helping veterans experiencing homelessness and veteran families. And so I think our goal is really to continue to build out the relationship. We also know that we have mutual grantees who are HVRP grantees who also work with Supportive Services for Veteran Families program or with grant and per diem or other VA homeless programs. And so we want to share some gratitude and thank you for working with us together over so many years. And then I think really we want to, I want to share just a little bit about the work that we're doing. So I'll talk primarily about SSVF, but I'm happy to take questions, especially related to bigger picture topics. Within Veteran Healthcare Administration, we have the Homeless Program Office, also known as HPO. We work through a one-team approach, so across all of our VA homeless programs, whether that's homeless veteran community and employment services or HUD-VASH or SSVF or grant and per diem or healthcare for homeless veterans, we're all one team. And so it's really important to us, both at the national level and at the local and state level, that feels super integrated as you're working with us. I started out as a practitioner in a local community, and I know how important that is to be a real team and to be able to share the work together and to creatively problem solve and to really support veterans and veteran families in the best way possible. Next slide, please. Okay, so this is a little bit about SSVF. We were developed under Section 604 of the Veterans Mental Health and Other Care Improvement Act of 2008, and we were authorized as a program. I was with SSVF at the almost beginning, so I started out as a regional coordinator with SSVF back in 2012. And so we started out as a model program under the National Center on Homelessness Among Veterans. So we had a lot of research and support next to us as we were developing, and then we became a fully fledged program. Supportive services grants are awarded to nonprofit organizations and also consumer cooperatives. And our grantees work on providing case management focused on housing and permanent housing plans with a range of supportive services. What I think is a little different with SSVF is that it's not a one-size-fits-all program. It's really about understanding the veteran or veteran family in front of us, their needs, any challenges related to permanent housing, and creating a very individualized plan together, and that plan can change over time. And then for fiscal year 26, so we operate on federal fiscal, so October 1 through September 30th. So these grants just started for fiscal year 26. We have 235 grantees at approximately 100 or $818 million. Next slide, please. Awesome. This is a little bit about our data. So I talked about the one team approach. So we have calendar or fiscal year goals every year. SSVF works across homeless programs, and we all work together on these goals. So we had a specific goal related to permanent housing placement. SSVF supported about 58% of those housing placements, or a little over 30,000. Also, specific outreach, I know you also do this as well, to veterans experiencing unsheltered homelessness or veteran families experiencing unsheltered homelessness. We supported about 45% of the outreach across homeless programs. So working together very concretely. And what I want to share too is that there was an announcement maybe 2 days ago, November 18th, just talking about the continued commitment to permanent housing for veterans experiencing homelessness. And so we're really proud of that. And we know that many of you were involved in that work. And also some of the surge events or getting veterans off the street events that happened this summer. So SSVF, this was our highest year in fiscal year 25. We served over 90,000 or over 99,000 veterans. A lot of people, and actually a significant number of children, over 33,000. So that's something that we continue to look at. We also continue to look at veterans who identify as having one or more disabilities. That's continued to increase. So when we started the program, it was like about 55%, and back in 2012, 2013, and now 73% of the veterans who we're serving have some form of a disability. And so we continue to look at other resources and how to support complex care needs to help veterans continue to maintain housing once they're housed. Awesome. Next slide, please. Okay, so we have some core concepts. I think our core concepts very much lead the work that we do. So when we are working with veterans, when our grantees are working with veterans, they're really thinking about how am I continuing to focus on the housing piece and the supportive services? What does that look like? How do we respond to the immediate crisis? You know, it's Friday at 5 p.m. or maybe like 4:45, let's just say, and a veteran is in crisis. Like, what do we do? How do we handle things to support the veteran over the weekend? And then what do we do Monday morning? So very much meeting the veteran or veteran family at their point of need. Veteran choice is really important to us too, that folks have the ability to decide things like where they want to live, or what is really important to them as they're thinking about their housing plan. Like, maybe they have part-time employment right now and they need to be close to some local transportation because they want to continue to pursue additional employment, and they know that that transportation piece is going to be really important. And then the last piece is progressive assistance. So again, this isn't a one size fits all. It's very much flexible and customized based on the veteran's needs, which again, those needs could change. Sometimes they change a couple times an hour, right? And that's totally fine. And so really starting out with like, what do we need at the moment? And we can add on as things change. So we've had veteran families, for like a very concrete example, who are doing okay with childcare as they're working on housing during the school year, but the summer months become a little bit more complicated when maybe school isn't in session if they have school-age children. And so do they need some childcare assistance perhaps to support during the summer? And what does that look like? And are there mainstream resources that we can tap into but maybe aren't available right today? And what does that look like for the veteran to be able to meet their needs? Okay, next slide, please. All right, so this is how we work. So we're a smaller program office. We're about 13 people total. And so our program office doesn't necessarily provide direct services. What we do is really focus on strategy, policy, technical assistance, and guidance. But we have this amazing network of SSVF grantees, 235 right now, who receive funding. Typically, they're community nonprofits or consumer cooperatives, and then they provide the direct services to veterans and veteran families. And so grantees work really closely to look at needs. And again, we talked about this progressive engagement approach. Next slide, please. Okay, so I think SSVF has definitely grown over the last 13 years or so. And I think there are a lot of different innovative and creative things that we're able to do. But at the heart of the work that we do are really two missions. One is to focus on veterans who are experiencing literal homelessness and veteran families, of course, too, and to rapidly rehouse them, helping them get back into permanent housing and wrapping supports around them. Our second mission is helping veterans and veteran families who are at imminent risk of literal homelessness to remain housed or to move their housing if needed. And so we do both, and this is really the heart of everything that we do. And we continue to learn. I think under Mission One, it has been absolutely critical for us as part of VA Homeless Program Office and one team to make sure that no veteran is outside, sleeping outside, right, or unsheltered. And so that has been a really big focus. But especially in our rural communities, we're doing a lot with prevention. And I think that that can be helpful too. Just to clarify for us, for prevention, it is imminent risk. So it's not like eviction prevention per se. And I'll talk a little bit more about this later. But really looking at what is the most immediate need. And it's typically like 30 days out. Okay, next slide, please. Awesome. Okay, so I wanted to give you a heads up just in case you are interested. We will have a notice of funding opportunity and NOFO that's hopefully published in early winter of 2025. We're working through the process. Um, but sometimes we have NOFO applications that are only for existing grantees, and sometimes we open it up. And so last year was an open up NOFO where we had a specific rural expansion. I think that there is some anticipation that there may be the opportunity for new applications in fiscal year 27. Again, we're still working through that process, but I just wanted to alert you. It would be published at grants.gov and the Federal Register. It is an online application through our grants management system. Everything has to be included in the application, including attachments. Nothing can be separate. And the notice of funding opportunity, when it's published, will outline priorities. So just wanted to give you a heads up that we do anticipate a NOFO coming. And anyone who was awarded would begin services October 1st, 2026, which would be fiscal year 27 for us. Next slide, please. Okay, I know we're jumping around, but I think that this is helpful. And it's not the prettiest slide, so I'm owning that too. But just to see where we've come from. So SSVF really started 2011, 2012. We were tiny. We were 85 grants and $60 million. We've definitely grown over the years. I think when we started out, it was about building foundations. We had all different organizations. So I think this is actually pretty cool with SSVF history too. We had universities, we had workforce development agencies, we had housing counseling agencies, continuum of care folks, domestic violence organizations, all veteran serving nonprofits, all different types of organizations. And I think in my mind, that really helped us a ton to see across services and to find intersects and to learn from each other. And then after that, we really focused on advancing our practice. So getting really good at rapid rehousing and prevention work. We built in accreditation and practice standards, and we developed a mentoring and mentee program. So kind of internal at first, and then we start working a bit more with community. We were still doing that early on, but really developing ways to work with our community partners. And at that time, looking at how we could help communities and systems to end veteran homelessness. 2018, 2020, I think a lot was happening with the pandemic and other supports. And so we were looking at opportunities to really expand housing, although not physically building housing, but how we could do that. And so we had some initiatives like Returning Home, which helps a veteran who maybe is in a community now, but might have supports in another community to go to that community. So, for example, maybe someone is living in Texas, but they have family in Pennsylvania, and being with that family would be really helpful to them in terms of a support network. We can, if they were eligible for SSVF, we could work on helping them get to Pennsylvania and so develop their housing there. Rapid resolution we'll talk about in just a little bit, and then shallow subsidies we'll talk about in a little bit too. 2020 to 2022, again, continuing to work through things. We also had some more flexibilities under the Stafford Act with the pandemic. We were doing a lot of hotel and motel, which we call emergency housing assistance. And we were continuing to develop housing navigators to support really making connections with landlords, finding housing opportunities. And there were some incentives both for landlords and veterans to support their permanent housing work. And then the last 3 years or so definitely focused on one team, enhancing partnerships across the board. We were able to increase our eligibility. We used to be up to 50% area median income for veterans on the income side of the house. Now we're up to 80% area median income. And last year we just released in our notice of funding opportunity a rural expansion. So that went live October 1 of this year, which is super, super exciting. And I am looking to continue to expand our work with families with children, knowing that we have over 33,000 children that we're working with and youth really want to focus on what services they may need to. Okay, next slide, please. Awesome. Okay, so I think SSVF from the work that I have spent at VA is really about being a connector and a collaborator and helping to create change. And so as we've seen needs over the years, we've been able to pivot. I think we try to listen really deeply to our grantees. They are partners in our work together. And when they're like, oh, you wrote this thing, but it actually isn't working super well. Here's some feedback. We really appreciate that. And I think we've also been able to, again, continue to enhance services based on what has been shared. And then I just want to call out this piece here. The data piece is really important to us. I don't know that I have the right word on this slide, but it's really about promoting access. So making sure that veterans are able to access the services that they need and deserve. And we know that that happens by creating deep connections and outreach and knowing our community partners who often make referrals to SSVF and vice versa. Okay, next slide, please. Awesome. Okay, so we talked about these individualized plans. We definitely, every veteran that we meet may have different needs. We know that. And so definitely focus on what might be helpful, even little things. And I know you all do this too, like how we might communicate with folks. You know, when we're working with younger veterans, technology might feel really comfortable. And so we might be able to do that more. If we're working with veterans who might be aging, they may have other needs, and we really want to be mindful of that too. Something that our housing navigators do, especially as we're working with aging veterans, is looking at, okay, we have this unit. Are there any accommodations that need to be made so that this veteran could be able to access what they need in the unit? And sometimes that's something minor, like a shower bar or something along those lines. And sometimes it's really thinking about the actual location and other supports and how they might get to healthcare appointments and all of those pieces. So just being super mindful of what folks need. Next slide, please. Awesome. Okay. So in addition to the case management and creating this housing stability plan, which we do with every veteran, we also, grantees can do outreach. They're all required to do outreach to veterans experiencing homelessness. Sometimes that's individual outreach. Sometimes it's going out as a team, maybe with their VA medical center partners. They can totally do that with HVRP partners too. And then it's also like service-based outreach too, like that the local library knows who SSVF is and they can connect people, or the laundromat, and just really being able to do that. And then of course, like emergency shelters and transitional housing programs as well, or food programs. SSVF provides case management. This is definitely one of the pieces that's the heart of our work, really those supportive services and navigating services. Assistance with benefits, including SSI, SSDI, housing navigation, which we've talked about. Some of our grantees have specialized positions. This isn't like, hey, here's some landlords, go call them. This is really pretty hands-on. Although every veteran is a different place. So sometimes we'll have a veteran who, you know, is like, I feel super comfortable finding a landlord. I would like to be able to present some options to you. And you go and we're like, great, that's wonderful, and we'll help you, or how can we help you? And some folks are like, I have no idea where to start, and I really need like step by step, and we'll do that too. We do have temporary financial assistance, which we call TFA. It is much more than just rent and utilities. And of course, like not everyone needs this. So I'm noting that as well. But it can include things like childcare, transportation assistance. We have a category called general housing stability assistance. Sometimes we learn that like a veteran was able to get a job, but they need like a specific set of boots or something that seems basic, but in order to be able to do the job, they would need that. And so under general housing stability assistance, that would be an eligible expense. Leading to healthcare, it's really important to us that folks have access to VA healthcare. And often family members might need community healthcare or support. And so that we're doing those linkages and making sure that folks are getting connected to primary care, but also all of the specialty services that they may need too. And we feel like healthcare is definitely a direct connection to our team and helping veterans to stay in housing. Definitely employment and training, credit counseling or financial education, and then legal assistance as well. Next slide, please. Okay, this is not the end all be all slide here. And I don't want you to be like, oh, it said it on the slide, and this is exactly what happens. Because again, every veteran situation is different, but this is just an example. So like rental assistance, typically if someone is within the income range, it would be up to 10 months in a 2-year period. But if they are extremely low income, so typically up to 30% AMI, then they could do a maximum of 12 months in a 2-year period or 9 months in a 12-month period. So this is just an example of what our grantees are looking at. And again, like not everyone needs transportation assistance. So if they didn't need that, then it wouldn't be part of our housing stability plan. But things could change and maybe eventually they do need transportation assistance, and then we can build that back in or build it in for the first time. Next slide, please. Okay, this is a little bit about temporary financial assistance in communities. So one of the things, and I'm sure you all encountered this too, was that at one point it was, I mean, and often it is really hard to find landlords. And so within the program, my predecessor, John Kuhn, developed landlord incentives, which can be up to 2 months of rent to say, hey, we have this veteran, maybe there is some uh like financial history, maybe they had some evictions on their records or something, and the landlord's like, oh, I don't know if I can take a risk. The landlord incentive might be used to help to get the veteran into housing. It is strategic, right? And so our grantees are looking at what is needed. Again, this doesn't mean that every landlord gets an incentive, but it is there as a tool and resource. Also, tenant move-in assistance. We had veterans who were like, it's great that I can have an apartment, but I don't have the basic things that I need. Like, I need a bed, or it would really just help me a lot if I could have this thing. And so, making sure that people are comfortable in the housing. And so, tenant move-in support is an eligible expense. Typically, though, it requires at least a 1-year lease. So just adding that, and then we talked about the expanded eligibility. Next slide, please. Thanks, Sarah. Okay, so we're flipping back to the 2 missions in SSVF, rapid rehousing and prevention. This one is focused on rapid rehousing. And so what we know is that by name lists used in communities are really important. Right now, within the one team or homeless program office approach, we have work that we're doing to make sure that every VA medical center and SSVF grantees and GPD are connected and supporting the community by name list. And there'll be a submission that happens December 1st, I believe, and then like monthly going forward. This is really focused on accountability and making sure that we're not missing any veterans. So I think this is where HVRP partners can be really helpful too. Maybe you're working with a veteran first and they're not totally known to the community or to SSVF or the medical center yet. Helping to get them connected so that they're on the by name list is really, really important. It just supports us in making sure that we know exactly who they are and what they need, and that we are focused on a path to permanent housing. We don't want to miss anyone, and yeah, it's just so important to us. And then we continue to use data, right? So we could house 100 people, but if we have like 10 people coming in each month, that's 120 coming into our system, our inflow. And so we just have to be mindful of that too, as we're looking at local resources and also making sure that we're continuing to manage both folks who are experiencing homelessness and the needs that they have right now, but also kind of projecting out what might be needed in the system going forward. Next slide, please. Okay, so we talked about the second priority within SSVF, homelessness prevention. Again, we're targeting folks who are at imminent risk. Um, I think that we're trying to get at the folks who are most at risk of experiencing homelessness. And so that can be, of course, a little bit tricky, right? Because it's hard to understand exactly who might actually become homeless. And so something that we've done that I think is really important is what we call rapid resolution. I was part of the team that developed it back in 2018. It's something similar to what communities might call diversion, but it's really about the veteran or veteran family is very, very, very close to going to an emergency shelter or being experiencing homelessness. And it's about having a conversation to just kind of pause for a second to talk about, what's happening, what the needs are, if there is any support that might be available, and it's getting creative to see if we can prevent folks from coming into the emergency system. Because when we do, we know that that has a really positive impact. And I can tell you that we have lots of stories where sometimes it was very like simple fixes, and that veterans actually were a huge partner in that because as we were talking together, they might say, "Oh yeah, I could stay with my sister for a little bit, but I'm not sure how to have a conversation with her because maybe we just had a fight. And I know that like she needs help with her bills too. Like if we're going to be there with myself and my kids, we might need to support some food costs. And what would that look like? And could SSVF help?" And so, of course, always just exploring options, just making sure that we are there again, meeting veterans and veteran families at their point of need. Okay, next slide, please. Okay, yep, this is a little bit more about rapid resolution. So all of our grantees are trained in rapid resolution. Again, just really making sure that we can explore options and support situations if it is safe and it would be okay for folks to stay where they're at or maybe with another support. Next slide, please. Okay. This next one is a visual about rapid resolution. I think we've had a lot of success with families, especially families with kids here too. No one wants a child to be homeless, right? And so, helping veterans, also reducing the trauma of needing to go to an emergency resource. Sometimes it's mediation and conflict resolution. Sometimes there's a little bit of financial assistance. Yes, household members can also be eligible for services too. All right, so now we're going to shift gears completely. So next slide, please, Sarah. All right, and now we're going to talk about, so we are talking about rapid resolution, which is an additional service in SSVF. We're going to talk a little bit about shallow subsidy, which is also a newer type service in SSVF. Or supportive service. But before we jump into shallow subsidy, just wanted to share a little bit about why that was important to us. So when we were looking at the housing market, and we know that some communities it is so, so expensive. I was talking with a community recently, and they were telling me it was like almost $2,200 for a studio in their community. I can't imagine where I live, it is a bit less. And so knowing that that is really hard across the board, and then especially if there isn't new housing being built or developed, really trying to access resources in that community. And so that was um, focused on shallow subsidy was focused on how can we be strategic? How can we also help veterans to increase their income while they're in housing, but to make sure that they don't lose their housing while they're in that process. So next slide, please. Okay. So shallow subsidy allows for services, support and rental assistance up to 2 years. One of the cool things about it is that there isn't a recertification that's required during that 2-year period. So we can work with veterans to help them with financial education and to increase their income, whether that is employment or benefits or a combination. And when they're able to get that higher income, it doesn't automatically kick them out of shallow subsidy, which I think can be so helpful in just getting folks to the next level. And so typically it's up to 50% of the rental subsidy over the 2-year period. And it has helped us a lot in being able to support veterans in accessing housing that maybe would have been challenging without that support. And then, of course, you all had been huge partners in the work in helping us with increasing income and potential for self-sufficiency. Next slide, please. Okay. Also, a cool thing about SSVF that sometimes I forget about, but it is really amazing, is that SSVF can serve the whole family, and the family is identified by the veteran. So we have had more than a few um, families who maybe it was the veteran, maybe their spouse, maybe the mother of the veteran and their kids, and that would be a family, right? And so I think that that can be really helpful in supporting what families look like and their compositions, and again, meeting them at their point of need. We do have a fair number of children right now that we're serving. And if there is intimate partner violence or domestic violence, we can support separating the household and the household that maybe was affected by the violence. Also has a reset in their temporary financial assistance for a little bit to help them to move forward as well. Next slide, please. Okay. This is Maslow's hierarchy of needs. Pretty sure you've seen this 1,000 times. I think for us, like we focus on this foundation, right? Of like, how do we make someone feel safe? How do we help them in the moment? And how do we support them so that they can get to these other spaces? And so that includes same-day screening and enrollment. Veteran has a crisis, they need to know if they could be eligible for SSVF, and our grantees can do that. That doesn't mean that like everything starts today, right? Of course, or for like Friday at 5. We're gonna get some things set up, but we may do a bit more Monday and Tuesday. But folks are back. Our services are not 24/7, but our grantees are very flexible in supporting veterans and veteran families. Emergency housing assistance. So if someone has no other place to go and maybe shelter isn't an option or transitional housing isn't an option, we can do emergency motel or hotel. That is up to 60 days, one time in a 2-year period. And then general housing stability assistance to help us. We've also had veterans who come to us on a Friday, the food bank is closed or the food pantry is closed, and they need a little bit of food to get them through the weekend. That would be something that general housing stability assistance could support. Okay, next slide, please. Okay, this is a little bit more about safety and support. Um, Yeah, I mean, we do a bit of triage, right? Often veterans might reach out to one of our grantees and maybe they haven't navigated services before. And so it's a little bit about understanding, again, the immediate situation and then planning forward longer term or short, medium term, perhaps. And then also being able to connect folks to other things that they might be eligible for. Um, Yes, and we do have access to Squares. I think it's called Squares 2.0 now. Don't quote me on that. And that helps us to also identify veteran status. So we need to know, again, veteran status and income eligibility as part of our eligibility determination. Okay, next slide, please. Okay, I think we've kind of talked about these already, but just in case you needed a little more visual, here it is. And here are some examples. So General Housing Stability Assistance, GHSA, is typically like life, health, safety type things. Just clarification, so SSVF does not provide direct healthcare. So we don't provide like direct mental health support, for example. But we could have items here like you would need kitchen utensils for being able to cook a healthy meal. That could be something that General Housing Stability Assistance supports. Also things like fees for housing applications or tenant screening reports, etc. Okay, next slide, please. All right. We do have folks who are really specialized in the housing market that they are working and serving in, and I think this is really, really helpful. And often landlords who want to rent to veterans and maybe a little bit more flexible, understanding the experience that a veteran experiencing homelessness might be going through. Um, and so really focused on not only the finding piece, but also what are the resources that are needed so a veteran can maintain their housing. All right, and now we're going to go into a little bit more about how we function. So next slide, please. Also new to SSVF or newer over the last few years is healthcare navigators. So every grantee is required to have at least one healthcare navigator. They are amazing individuals. We just did some work with them in September and they have a community practice as well. And they are really focused on supporting veterans and non-veterans in the family and connecting to services, accessing care at medical centers, maybe accessing mental health, sometimes community providers too. We've had folks who are working with a veteran who is pregnant and thinking about prenatal care and what that looks like and getting them connected to those resources. They help participants to overcome barriers to care too. I feel like the healthcare world is a whole different space, and sometimes it's hard to understand, what is actually needed or how to get those appointments set up, or what to do after you meet with a doctor and need to do some follow-ups. And so healthcare navigators are really good at that. They're also really good at saying like, okay, you have a CPAP machine, you've been a little bit behind on some of your utilities, but we need to make sure that you're able to continue to have maybe your electricity because you need your CPAP machine every night, right? And so really thinking through intersects of health and housing. And then, yes, of course, additional information to support folks in their needs. Okay, next slide, please. This is a little bit more about the approach. So I know we're toggling back and forth a bit, but progressive assistance, there's no one size fits all. We start with a small amount of assistance and then we can scale up as needed. And again, things can flex in and out. And services are just as important as financial assistance. And so we couple those together, right? It's not just rental assistance. We're really looking at like, what were some barriers to be able to, pay your rent in the past if that was a challenge, and how do we work on overcoming them together? Next slide, please. Okay, so this is just a little bit about data. We have a pretty low return rate across VA homeless programs. Last year in fiscal year 25, I believe we were less than 5% return within the past year. But this is just a note. I think we work really hard to set people up to be supported and to use their strengths. And I know you all do that as well. And we really rely on help with, oh, thanks for the emojis. We really rely on your support too, especially with the employment piece of things. I know that can be really hard to navigate too. Again, another system. And I think that, we know that once people have stable income, though, it really helps them move forward. So next slide, please. Okay. Oh yeah, I love the emojis. This is great. So now I think we have some ample time here. Love to open it up to any questions or dialogue that you'd like to have. Again, very much the work that we've done is really partnership and collaboration and working together and learning together. So yeah, I'm gonna open it up to you all.
Go ahead and add your questions into the chat or raise your hand and we will unmute you. Also, you will see we've got a survey in the chat, so please take some time to take that survey and let us know how we're doing. And I will check the chat. Any questions at all? Go ahead and raise your hand or add it in the chat. All right, we've got Sean. I will go ahead and unmute you. All right. Sean, you should be ready to unmute. I think Is it not working? Can you unmute yourself?
Okay, finally worked.
Trying to.
I'm
Yes.
so
Hi,
sorry
Sean.
about that. Hi, how are you today? I hope everyone is well. I am the CEO and founder of Gabriel Shift Global Impact Center. And what we have done, we actually have a group of apprenticeship and pre-apprenticeship programs to teach people accounting, to be accounting technicians, and we also teach financial psychology in our workshops. So how would we get involved with that? Should we get involved with SSVF through an HVRP program, or should we just go to an SSVF grantee and offer our services? Or how can we be involved with that, given that we have apprenticeships?
Yeah, Sean, I love that you are asking this question. It's a really good one. I think what I can do is pop a link to all of our grantees in the chat. So I am pretty sure there's probably a local SSVF grantee or two close to you. And I think having a conversation with them would be great. If you were looking at providing the full scale of SSVF services, so the housing case management and the navigation and all of those pieces, again, like everyone is welcome or more than welcome to take a look at our notice of funding opportunity when it goes live. But again, partnerships I think are super great, and love that you're doing financial psychology support too. So I will pop that link to grantees in the chat. And thank you so much for the question.
Thank you. And the last question is, as far as we're going to be applying for the HVRP grant, how do we partner? Same thing?
Um, Sean, are you thinking like how do you partner with SSVF if you're applying for HVRP?
Correct.
I'm happy to speak on the SSVF front, but I would love for the VETS team to maybe talk a little bit about HVRP. So I think on the SSVF front, being able to look at the grantees that currently exist and having a conversation with them, seeing if maybe you could do some collaboration or if you were interested in being like a subcontractor under them, that's always an option too, or applying directly. But would love to pass it over to the VETS folks for HVRP.
All right. Thank you.
Great question. I was actually going to ask the grant recipients on the line who operate both SSVF and HVRP what your experience is creating that streamlined partnership. Is there anybody, actually, Joy, we've got you on. I don't know if you wanted, I know you had another question. I don't want to put you on the spot, Joy. But if you'd like to answer that as well, I know you all have SSVF in-house as well. And I have unmuted you, Joy, if you'd like.
Yes, thank you. I see that. Yes, to the young lady that was just speaking, we need to share information because here at Harvard, with the veteran program, we have both HVRP and SSVF. And a collaboration with you, with a lot of our clients that you offer apprenticeships and trainings and things like that. Because I have one young lady that has multiple degrees in accounting, and she would be great for your program. So if you want me to leave my information in your chat, I can do that. You can reach out to me. But yes, we coincide when we are putting people into SSVF. We also try to enroll them into, if they are wanting and willing to work, we enroll them into HPRP as well. We also deal with other agencies that refer them to HPRP that we all collaborate with, as well as other counties. Okay, and they will refer their clients to me, basically, to our program. So if you have any other questions, I'm sorry, my voice is just not the best of the best right now, but I'll be willing and wanting to get back with you because I would really like this collaboration. Thank you.
Thank you so much, Joy, for offering that. And also, Joy, I did see your hand up. Did you have a question for Adrian that you'd like to ask?
No, ma'am, because I was listening, she answered the question, so it's okay. Thank you.
Okay. Yes. Thank you, Joy. Nice to see you. Great. Any other questions? Either put it in the chat or go ahead and ask for Adrian. And yes, if anybody would like to connect on the chat, do please put your email address and contact information there. That is also the wonderful purpose of a community practice, is to share as well. Any final questions for Adrian on SSVF, on any of the processes, even from your perspective, how you're operating SSVF and, alongside HVRP, any insights, anything at all that you'd like to share? Well, thank you all so much for your time today. It is so lovely to have you all on. Again, please take some time to fill out the Community of Practice survey. I'll just drop it in one more time. So please take some time to fill that out. And we really appreciate all of you on today. Oh, I do see in the chat, I am more interested in knowing about accounting apprenticeships. I'm with HVRP. Okay. And then we've also got Joy's contact information. Thank you so much. Great. Any final questions or thoughts or comments before we say goodbye today? Well, thank you again, Adrian, for coming and presenting this awesome topic that absolutely applies to us. Thank you so much for your time. We have loved having you. And please come again real soon for presenting. Thank you.